Thank you, Mr. President. I come to the Senate floor once again to urge my colleagues to work in a bipartisan, transparent fashion to improve our health care system and help bring down costs. Over the weekend, members of the American Medical Association, the nation's largest doctors organization, had a chance to finally read the proposed Republican bill, and found that it violates their do no harm principle. According to a letter they wrote to leaders McConnell and Schumer, medicine has long operated under the precept of primum non nocere, or first do no harm. The draft legislation violates that standard on many levels, and that is the conclusion of the American Medical Association, and they are correct. This bill will not lower costs, and it will not improve our health care system. Instead, it will remove health insurance coverage from millions of Americans. Indeed, the CBO has just released their estimate that 22 million Americans will lose their health insurance coverage. It will increase costs for everyone and decimate state budgets, creating a ripple effect throughout our economy. The bill that my colleagues worked and seek to craft is, in a sense, a sham. It will not lower costs. It will not improve our health care system, as they insist. Instead, it will remove health insurance coverage from millions of Americans, 22 million according to the CBO. Increase costs for everyone, as I said, decimate state budgets. In fact, their bill essentially is a huge tax cut for the wealthiest 2% of Americans at the expense of everyone else. If you need any further proof for the real drive of this bill, one of its biggest giveaways is a retroactive tax break on investment income for people making at least $250,000. Dozens of leading economists, including 6 Nobel laureates, have criticized this plan as, in their words, a giant step in the wrong direction that prioritizes tax breaks averaging $200,000 annually per household in the top 0.1% of Americans over the well-being of working families. In fact, President Trump himself will get an estimated $2 million tax break each year from the giveaways in this bill. Let's call this bill what it is, a massive giveaway to the wealthiest Americans. Meanwhile, the rest of the country, all of our constituents, will be the ones paying the price for these tax breaks for those well off. So much for the president's claim that he would end a rigged system. Now, how do Republicans pay for these tax breaks? For starters, they are proposed to end the Medicaid expansion under the Affordable Care Act, which has provided health insurance to nearly 15 million Americans. But then they go even further by effectively block granting Medicaid, cutting hundreds of billions of dollars in the program over the next decade. These are not reforms designed to lower costs. This is a cut, pure and simple, which will sharply curtail and eliminate needed health care services to many across this country. In fact, the Center on Budget Priorities and Policies published data that shows a stark contrast of who gains and who loses under this bill. The 400 households in the country with the highest incomes, will get tax breaks totaling $33 billion because of the Senate Trump Care bill. And as a result, over 725,000 Americans will lose Medicaid coverage in just 4 states to equate to that $33 billion, Alaska, Arkansas, Nevada, and West Virginia. And that doesn't even scratch the surface as to who will lose access to care in the remaining 46 states. Medicaid has played a critical role in ensuring access to care for millions of Americans, including children, seniors, and people with disabilities. In fact, across the country, and in my home state of Rhode Island, about half of all Medicaid's funding is spent on nursing home care. Over 60% of nursing home residents access care through Medicaid. If you think that nursing home care will be protected, you are in for a rude awakening, because the math just doesn't work. It will be impossible to cut federal funding for state Medicaid programs by hundreds of billions of dollars and not impact the most significant Medicaid expenditures, which are nursing homes. I'd also like to talk about the role that Medicaid plays in emergencies like a recession or public health crisis. We know all too well how an economic downturn impacts communities. With job loss comes the loss of health insurance, pensions, and other benefits. The tax base shrinks, and state budgets suffer. Medicaid, as currently structured, is able to adapt to this. As the need increases, the program grows to cover everyone who is eligible, including those who have just lost jobs. This saves families from having to choose whether to take their kids to the doctor or put food on the table. Under the Senate Trump Care bill, states will be hamstrung by arbitrary caps and limits on Medicaid. In fact, states will be unable to expand coverage during a recession to those in need, and they will likely have to make cuts across the board, from health care and education to transportation and infrastructure, to make up for the lost tax revenue. This is not strictly going to be an issue of health care policy in states. The cuts are so dramatic that after they've taken all they can from other health care programs, they will inevitably go to education funding, which is the biggest expense most states have, and then to transportation, and then to public safety. And even then, I don't think they can keep up with these cuts. Like most of the country, Rhode Island was hard hit by the recession. It took many years for the economy to even begin to turn around in the right direction. It seemed my colleagues are forgetting how Medicaid has been a critical safety net through tough economic times. I'm also concerned that my colleagues are not aware of the impact Medicaid has on our nation's veterans. The uninsured rate among veterans has dropped by 40% since implementation of the Affordable Care Act. Nationwide, nearly 1 in 10 veterans is covered by Medicaid, including approximately 8,000 veterans in my home state of Rhode Island. The cuts to Medicaid that have been proposed by our Republican colleagues put the care of our veterans at risk. We have all promised to provide the best care possible to our brave men and women when they leave the service. But the Senate Trump Care bill would do the opposite. And that's not the only way this bill could damage veterans' care. Many veterans seek help for mental health care by going outside of the VA system. Trump Care puts mental health and substance abuse treatment at risk by saying that insurance companies no longer need to cover these services. For the over 15,000 veterans in Rhode Island who access mental and behavioral health care outside of the VA, they would be out of luck. For all the bipartisan work in this chamber to increase veterans' access to these services, it would all be for naught if Senate Republicans passed their Trump Care bill. These are just some of the things that Republicans are sacrificing in the name of tax breaks for the wealthy. It is frankly unconscionable. And more importantly, this will not be lost on the American people. I have heard from thousands of my constituents since the beginning of this year. And if Senate Republicans decide to press forward with this legislation, I think we will all hear from many more of these constituents for many years to come. Trump Care is fundamentally flawed and cannot be fixed. We would welcome the opportunity to work across the aisle on improvements to the Affordable Care Act, like those to lower costs, especially prescription drug costs, anytime. So I once again urge my colleagues to drop their effort and work with us to instead make improvements to the ACA.